A survey of more than 26,000 workers has found employees are experiencing more psychological injuries in the workplace than physical injuries.
The ACTU is calling for better legal protection after its survey found 60% of respondents had experienced psychological illnesses or injuries at work, like stress, depression or anxiety. And for more on this, we can speak to Emi Golding, who is the Director of Psychology at the Workplace Mental Health Institute, and she joins us now from Madrid. Emi Golding, thanks very much for your time. Looking at these statistics from this research that was released by the national union body, almost half of those surveyed experienced a traumatic or distressing situation at work in the last 12 months. Do these results surprise you?
Not at all. Mental health is a tsunami that's coming to workplaces. So this doesn't surprise me at all. It's exactly what we're seeing at the Workplace Mental Health Institute, exactly why we wrote the book Mental Well. People are stressed people to get irritable, they lash out at others, and that causes more stress, conflict. It's a downward spiral for organisations.
So has stress and anxiety amongst workers actually increased, or do you think we're just more aware of how it manifests and its impact?
Look, I think it's definitely true that we are more aware of it these days, and there is a growing conversation about the need to address mental health both in society in general and in the workplace. But I do think that definitely it is a real increase in stresses in the workplace. I mean, industries are changing. Change is a lot faster than it ever was before. Typically, as humans, we're not great at dealing with that. We're seeing the pace of work increasing, where we're expected to do things faster and faster. At the same time, we are expected to do more with less. So organisations are downsizing, getting leaner, and people are often doing jobs that used to be done by 2 or even 3 people.
Now, you've authored a book as a guide for managers, I imagine because managers simply aren't equipped well enough to deal with the mental health of their employees. What is the responsibility of the employer, and particularly those in management?
Yes. Well, there's a legal responsibility first and foremost. The Workplace Health and Safety legislation says that managers are responsible for ensuring a psychologically safe workplace. The problem is the legislation doesn't exactly tell them how to do that. So they have this responsibility, but they're not given any guidance. So that's why we put the book together. That's why we go into workplaces and upskill those managers who have that critical role in looking after the well-being of their workforce.
And what, in terms of that responsibility then, is building resilience? How does that come into the equation? Surely managers have to go beyond just looking at whether employees are stressed or suffering from anxiety or other mental health issues. Do they then have to look at, well, how can we prevent that in the first place?
Absolutely. Well, the smart managers will. And I'm so glad you raised it, because that is sort of one of the concerns that we see, is that a lot of organisations at the moment are still quite reactive to when there is a problem. They want to know how to respond, and they should know how to respond appropriately, to say the right thing and do the right thing. But it is so much more important that we also have that prevention piece in place, so that we don't get to that space where people are at their wits' end, so that we can build those emotionally fit and resilient teams who can face the challenges that work brings and that life inevitably brings as well.
You said that a tsunami of mental health issues is hitting the workplace. What if businesses and managers don't address the mental health of their employees?
Well, we're already seeing that rates of absenteeism are increasing. So the average person who is diagnosed with depression, for example, takes 3 to 4 days off per month. So there's a huge cost to businesses in absenteeism, but even more so is presenteeism. And that means when the person shows up at work, but they're not really all there capable to perform their job as they normally would. So that productivity is impacted, by 50%. We're seeing increases in psychological injury claims. So there's absolutely that financial cost to organisations, which, by the way, doesn't always show up on your profit and loss statement, but it's most definitely there. And then, of course, there's the human aspect as well. We spend so much of our lives at work, and so we're with our colleagues day in, day out. So those human relationships are so important, and it's unfortunate that sometimes we are approached by organisations who perhaps haven't been aware of the importance of this in the past, and they come to us now after some sort of incident has occurred saying, we wish we'd done something sooner to look after our people, because we do care as well.
Emi Golding, thanks very much for joining us on ABC News.